Although coronavirus has not been detected in our state, we do expect cases here. I think we've been fortunate that we have not been amongst the first states, and we're very fortunate that we don't have what's going on in Washington State, our neighbor, right now. But we've been watching that very closely, and we are learning and communicating with Washington and with other states, with CDC daily on this growing and changing situation. Our public health goal in Idaho and across the nation is to slow this virus down. We probably can't stop it. The cat is, is the cat out of the bag? It's too late to stop it. I'm mixing my metaphors, but we know that we can't stop it at this point. It is too late for that. It is in many other countries. It is circulating already in communities in Washington State. But what we can do is slow the virus down. And how that helps is it helps in several ways. We can reduce the impact and burden on the healthcare system. Hospitals, urgent care centers, emergency departments, clinics, long-term care facilities, they cannot handle a huge sudden influx of a lot of ill people. So by working to do the common sense measures that the governor and the director just mentioned, we can protect the vulnerable among us by keeping this virus from spreading person to person. So we need to focus on protecting our healthcare system, so when those people do get ill, they have a place to go and are able to be taken care of well. We can also try to slow down the virus, hoping that with the end of flu season, sometimes other viral respiratory diseases also decline. So if we are fortunate, we don't know this will happen, but it is possible that cases will naturally start to decline and we'll have bought some time. It could return again next fall. We don't know yet. It's a new virus, but that's a goal of one reason we're trying to slow this down. Thirdly, this time is allowing us to educate communities, get employers to figure out work-from-home plans that could be put into place if needed, schools planning for children's safety and school closures if needed. That is all important work, and we have a little bit of time to plan that, and the slower this goes, the more time we'll have. Lastly, I'm sure that you're aware that for pandemic flu, we were able to come up with the public health system, vaccine, and that was in the 2009 pandemic. We know that it'll be up to a year or more before a vaccine is available. So the more we can slow this down, damp this down, the closer we will be to having a vaccine or treatment. There's no antiviral treatment yet in the United States, but we are hoping that that'll eventually, there are studies already underway of some antiviral treatments. We are hoping those will be available eventually. So if we can slow this down, we can help everybody, including the health system and our most vulnerable. I want to mention testing. We've certainly been getting a lot of questions about laboratory testing, and I know there's been a lot of changes even at the federal level in the last 24 hours on this. Our state public health laboratory was one of the first laboratories in the country to validate the CDC test, and we have been offering testing. They announced this testing on February 20th. We have been offering testing. We've been working with healthcare providers on a daily basis, and we have been testing in Idaho. This is not true of all states, so we feel very fortunate that we've been able to do that. We are also, although our testing capacity is limited, we are requiring a public health process for approval for testing, because we just don't have that many test kits, and we want to save those for the highest risk, for the most ill. But we have been assured that more tests are on the way, and we are also understood just yesterday that the FDA has authorized some other sectors. University of Washington, for example, apparently can do testing now. We are working hard to learn more about that and to see whether Idaho providers could avail themselves of that testing eventually for their patients. As the governor mentioned, the good news so far is it appears that children to be less vulnerable than adults. We don't know that that is going to stay that way. I want to always emphasize that this is a new virus. We are learning about it. We're all reading the data from China. We're all reading the data from other countries that are starting to publish about their cases in the medical literature. But everything so far is reassuring about our kids' safety. And I know as a parent myself, and I'm sure many of you out there are very encouraged to hear that. It doesn't mean, though, that kids can't get this virus and can get sick from it, but it appears they tolerate it better than us adults do. So there may be the need down the road for schools to change their practices and to potentially even close to prevent spread. So it's sort of something to be aware of, that children can be impacted, but at least don't seem to be as severely impacted as adults. Lastly, I just want to mention, as the governor and the director did, that we our responsibility now as citizens is to protect our vulnerable population, and we can all help. The measures already mentioned that you've heard, I'm sure, 1,000 times in the last few weeks is to wash your hands. I know hand sanitizer is hard to find, but if you can, have hand sanitizer with you. There are recipes floating around out there for how to make your own hand sanitizer that I can't absolutely vouch for, but they seem very reasonable to me. I've been looking at that recipe myself. So keep your hands clean. Try to avoid I touch my face a lot. I have allergies and I'm always rubbing my nose and stuff. So we all have to work on that. Trying not to touch your own face. And then if you do get ill, stay home. We know that for many people, they need to work, and they may feel that they need to go out and work in an office building or in a place where they might come in contact with other people. The more we can do as employers to make sure people have the opportunity to work from home or to work in areas where they're not around other people, we need to work with people so they don't feel compelled to come to work sick. Lastly, I just want to remind everyone this is a very fluid, fast-moving situation, and as we respond, we want to remind you, we'll try to keep everybody updated. I'm so grateful that this working group has been started, and I want to acknowledge Elke Shaw-Tulloch is in the room today as well. Our administrator has been working tirelessly to get this done, but we are working hard. We're at capacity. I'm so grateful that we're getting more help now across the agencies. We are really, really grateful for what the governor has done, and look forward to continue to work on this.